Hello. Am I audible?
Hello.
Yes, can you hear me?
Yes.
Okay, fine. So we will be starting our session soon. It's a special session today. It's a session with great importance, I want to say, because we had an announcement in our group yesterday. Hope everyone have seen that. So on the basis of that, we have a session today, which is actually about total preparation plan for pieces. Okay, so sometimes we take this sort of sessions sometimes in mid of our course, or sometimes even in the even during the start of the sessions, so these are very important talks. So I'm just waiting for some other candidates to join, then we'll start. Okay, so last day I announced that we will actually discuss about some secrets of paces, that what will be your mind setup and what will be your total preparation plan when you are with paces work. And suppose you have some time of like 3 to 4 months or even 6 months, so how should you approach for your studies, and how you need to prepare yourself mentally and totally as a uh, confident doctor to pass the paces. So this is what about today's session, and this session is actually the most vital part. I think I really think like that. So I want to mention that actually we have some announcement yesterday that I told that actually this group that we are running right now is actually combinations of different candidates who joined at different phase of their preparation. Like we started this online course particularly in this May of this year. Okay, so those who joined during the May after 5 or 6 trial classes. So there are so many candidates who joined at May, and they are actually ending their sessions in this October. All right. So actually, this is a great journey with them, and we are very happy to serve them as far we could do. And we have tried our best to make them confident candidates. But the thing is that, well, I really want to say that even the third diet exam is postponed. The preparations you have taken with the PACES work will be definitely fruitful for you in your journey in the fast diet as well. All right. So, and some of the candidates who joined in the middle of the courses, okay, like in the June, July, August, different time, our candidates were added in our courses, and they have been practicing. And as it is a continuous process, PACES is a dynamic preparation, and it just goes on and on. There is no stop in the PACES preparation, So some of you are having taking our course for 1 month, 2 months, or even 3 months. So in the middle of the course, all right. So there are candidates like that, and also you all know that we are going to arrange the this third diet. Actually, the intensive that was planned is due to the for the third diet actually. But most of the exam centers is postponed. But even we have decided to go for the intensive, because the gap between the third diet and the fast diet is not so much. like 2 months or even 3 months. Actually, it's November and December, January, and the fast diet starts from the February, actually, in the particularly the Indian and international centers. And in UK, some of the centers are even in the January and February as well. So there is no such gap, actually. That's why we decided, why not to go for the intensive, so that if anyone gets scope in the fast diet or even in the January or February in the UK, so they will be very much benefited from the intensive course. That's why we started it. So right now, what is the today's session all about? Today's session is all about all of our candidates who are with PACES work. So what will be their mode of preparations by your own? Okay, so please mute yourself. I'm getting some noises, actually. Okay, so the thing is that we have we decided to take this session as part of your total preparation, that how you should study, what resources you need to do, and how you need to practice yourself daily. And these things are very important for passing the PACES, because PACES is a tricky exam. It's the exam of tricks, I want to say. And if you are not well organized, not well structured, and if you don't know the tricks of passing the PACES early, if you don't know the PACES mark sheet, mark scheme, so then you will be in trouble. So there is so many things you have to understand first before you go for the exam. Any course will not be helpful if you don't know the tricks of the PACES, the secrets of the PACES. Okay, so this session is all about that how you will pass the PACES in the first attempt with the shortest duration of preparation, fruitful preparation, that will actually make you a good candidate, confident candidate, and pass PACES smoothly. Okay, so let's start the session. We have been waiting for long. I think that many candidates will be watching the video from the Facebook, and also they will get the recording. So as it is not a practice session, so they will uh, learn these things from the videos. I think this is good. Okay, so first we will start with the most vital thing, that is the station 4, preparation of station 4, that how my candidates, PACES work candidates, will prepare for station 4. This is the most vital station, and nowadays you candidates are mostly thinking of the this station 4, but I want to say something about this station. Okay, so station 4 has some specialities. Number 1, it's variable. It is vulnerable. It's not always well calibrated. Differs in examiners. So that's why the station 4 is quite one of the station that is been taken very seriously by the PACES candidates. Like, you know, that other stations are pretty much well structured, very much organized, and other station, the preparation of those stations are in your hand, and it will be easily gettable. The marks will be easily gettable. But the thing is that this station 4, there are diverse cases. Okay, there are diverse cases, and there are so many scenarios. Okay, so many scenarios, and every scenario has some ethical principle, legal principles. All right, and not only that, the calibration of the cases are quite hidden. We actually, sometimes what happens, what is the calibration of the Royal College, even still we don't know that. Okay, there are so many controversial cases like that. Sometimes we even don't know that what was their calibration. Okay, even no one knows. Sometimes what happens, same scenario. Okay, same scenario, the one candidate did that in one center. Okay, got full marks, and same scenario was done by similarly in another center, and examiners were not happy with that candidate, so that candidate didn't got good mark and failed. Sometimes we have experiences like that, that what happened, two examiners are there. If each examiner have 8 marks to give you, that means uh, total 16 marks. So we have seen sometimes that one examiner has given 8 and another examiner has given 2 to the same candidate, So one examiner is giving you 8 and another examiner is giving you 2. That's why I have told that it is variable. That means it is not constant. So in case of station 2, in case of station 5, whenever you will take the history, you will do the examinations, it is actually standardized. It is not variable. Whenever you will do those things in front of a good examiner, so their attitude to you will be similar. But in case of station 4, the examiners will differ in different grounds. Examiners' motive will be different. One examiner might like you, one examiner might not like you. And another thing, the cases might be new and you don't know the calibration. And there is a possibility that this case will not be common. Okay? Not be common, not from any textbook. It is newly made. It is a possibility. And sometimes it is also a possibility that the case is old. We have practiced in the course, but unfortunately, the calibration of that center where the exam has taken place is quite different from how you practiced in your course or previously. So that even you got the case common, but you don't get the full marks, or there are some carteling of the marks. All right. So I tell it that it is variable, it is vulnerable, because anytime you can slip, due to maybe your surrogate may be bad, the surrogate was not give you proper histories. Okay, and the surrogate was not cooperative, much talkative. Okay, so you couldn't counsel him properly. All right. And there is also a possibility that your examiners are not friendly with you, and the way you did it was not okay, so you get quite less mark. Just a minute. Okay, so that's why this station is variable. Hello, can everyone hear me? Am I audible? Hello.
Yes, you're audible.
Yes, yes,
Okay, fine.
can
So
hear you.
what I was saying that, all right. So this is variable station. This is vulnerable. There are so many factors. It can be the examiner who will give you good mark or bad mark, and it will differ from examiner to examiner. it will also depend upon the surrogate. Okay, that the surrogate might be good, surrogate might be bad. uh, the surrogate might be cooperative, might be over talkative, might be too much silent. Okay, not cooperating with you, not answering you properly. So the surrogate facts are there. Number 3, the calibration means how the Royal College calibrated that case and how practiced you in the course. And that's where your course is important. Like you are doing the course in the PACES work, all right? So we have almost 20 mentors in our course. And if we count the examination history of 20 mentors at least, so how many cases we know properly? All right, so you have to do course in a big course. That is something like PACES work I want to mention, because we have a big gang of doctors. Because for last 3 years we have trained more than 200 doctors, over the 200 doctors we have passed more than 45 doctors, like 49 doctors have passed. That means we have experiences from 200 doctors, that how they appeared in the PACES. All right, so we know their cases and how they did that and how much marks they got. So that experience they shared with us. That's why you are doing the course, because we know that what is the hidden secret or what is the calibration of that particular case. All right, like which questions will be asked by the surrogate, which questions will be hidden, which things will be the most vital part in particular station 4. We know, all know this, and these things are only can be shared by the candidates who have given the exam. It is not written in the book, it is nowhere, but you will come to know if you talk with the candidates. That's why the big gangs are important, because we have so many candidates who are taking our course. Like right now in the PACES work group you are following in the WhatsApp, we have almost 40 candidates currently doing our course. Maybe today the attendance is quite poor because there is no mock session today, but all are my students. So whenever you will appear in the PACES exam, what will happen? Whenever you give the PACES exam, you talk with me and I take your history, I take your experience. And that's how I know that yes, my candidate did it like that and she got that mark. So suppose you do a station 4 in the your PACES exam and you got 16 out of 16. That means the way you did that station 4 was perfect. And what was the concern of your surrogate who was set in the exam? So all the experience you are sharing with Dr. Shadli. So whenever we are getting our future candidates, we will give that input. And if we find that you get very poor mark in a station 4, like some station 4 was given and you got only 6 or 7, that means your approach was totally wrong and it was not the calibration of the Royal College. Then we become very conscious, and what we do, we try to search other candidates, like how they did and how much marks they got. All right, so then we formulate the our calibration that this case should be done like this. Okay, so there are cases like tramadol, there are cases like beta blocker overdose, there are cases like gliclazide overdose, there are some cases of postmortems, there are some controversial cases which will be there and which was there previously. So we always take the inputs from the candidates, but it varies from examiner to examiner, center to centers. So you never know that how much mark you will get. But that's why you are doing the course, because the way we try to train you in our course in a way that you play safe, and you stay in the safe zone. Sometimes we don't know the calibration of the Royal College examiners, but the mentors you are facing in the PACES work, we try to tell you the technique that if you do this station 4 like this way, in this approach, then you will be at least in the safe zone. You will not be blundering it. So maybe you are not getting 16, but you will get like 14 or 12. So but you will not blunder it. Okay, but if you don't take our courses or you stay alone, you take preparation alone and you don't have a big PACES community, so there is high chance that you will end up with 6 or 8. All right, so that's what I try to say about the station 4. Okay, so now That's why this station is quite, I want to say that unpredictable. Unpredictable. All right. So whenever you know in your life that that something is unpredictable, something is unpredictable, and something is non predictable. Okay. So what can you please recall? Can you please recall then when you were in your primary studies or secondary school certificate examinations or A level and O levels, what was taught by your teachers? Suppose in math exams, you are giving the math exams. What was the instructions of your teacher? They always told you that please do those mathematics which you can answer properly. Okay, that yes, I am pretty confident that I can perform this mathematics. Okay, so these are common things, and I can easily do that, and I will take full marks from that. But sometimes what happens, in case some mathematics are very much difficult, okay, and those you are not sure about that, so there is chance that you might, there is 50-50 chance that you might get full marks, or you might even end up with some wrong answers, and in that case you are might be going in the wrong direction. So the instruction was that take the preparation very well in your strong zone. So if you take preparation in the strong zone, then there is high chance that you will pass, all right, and you will get a good number, even if you lose some marks in some unpredictable zone. Okay, so right now what is happening in the paces era right now at this point, what you all guys are running after some unpredictable thing. Okay, unpredictable thing, much and much. But the thing is that you are ignoring the parts which is easily attainable, easily gettable, and full marks can be done. So you are ignoring that part, and that's why you are easily failing the total exam. All right. So station 4 is okay, we know it, we are doing so many station 4 cases, but even though I want to say that it is unpredictable, so don't be obsessed with station 4 preparation. Some of the candidates are obsessed with it, okay, and over obsessed with it, but it is a wrong decision, and it will actually means nothing. All right, even I have candidates who got only 6 out of 16 and passed paces with almost 145 marks. So it is not a matter at all, even if you fail in this station. So please don't be obsessed with this station. Take preparations in the other stations so strong that even if you fall in the station 4, it should not hamper your paces result. All right. So right now I want to mention that what is the specialty of this station that is actually making you concerned. All right, so there is particularly two vital things. Number one is clinical communication, and concern. Okay, so these two skills are particularly here in this station 4 station. That means clinical communication and concern skill, and we all know that these two skills are pretty tough to pass. All right, but here is the important thing that these two skills are also in station 2 and also in station 5. All right, so if you are very good at station 2 and station 5, in that case this clinical communication and concern part will be easily passed. There will be no issues with that. You all know that you have to get 130 out of 172 to pass the paces, and I can assure you that the all my candidates who are attaining my paces work course will easily get that 130 130 marks. Undoubtedly you will easily get that. But where candidates fail in skills like science skill, physical science skill they fail, clinical communication they fail, concern in concerns they might fail. Okay, rarely they might fail in the judgment and differentials. Okay, you know that there are 7 skills. So if I put the most danger skills, so number 1 danger skill is physical sign, number 2 it is clinical communication, number 3 it is the concern. Okay, so these 3 skills are most difficult to pass, and in case of station 4, the vulnerable skills are clinical communication and the concern. The most vital thing is that you are getting these skills also from the station 2 and also from the station 5. So if your station 2 and 5 preparation is 100% and you are pretty confident that you get full marks or at least 90% marks from that predicted stations, then passing the paces is very easy. Passing the paces is very easy. But what happens, you people, you are obsessed with station 4 preparation. You are doing so many courses. You are just digging a station 4 for week. You are just concerned about this station 4 for too much that you ignore the preparation of the station 2 and station 5. What happens in the PACES exam? So you are running after the unpredictable thing, and if your luck is bad, even after so much preparation, you might end up with poor mark in the station 4. All right, and side by side your station 2 and 5 preparation is not that good, so you easily fail in the clinical communication and the concern skill, and you fail the PACES. So that's why today's topic is secret of PACES. All right, so I am sharing the secrets of PACES with you, that how you can easily pass PACES. These things will not be maybe shared with other mentors, I think, because I am training candidates for last 3 years with very high pass rate. I really know that these things are very important and you have to know that. All right, so make your preparations like that. So you have to be a 100% prepared candidate for your station 2 and 5. And how will you do that? I am coming to that point after ending the station 4 preparation. Okay, now, so this is about the station 4 thing. It is unpredictable. Even you take 100% preparation, you do all over the courses all over the world, you might end up with some poor marks. So okay, you will take all the preparations. I don't have any objections with that, but don't be obsessed with that. Give equal emphasis to all other stations, because it will make pass easily, because those are predictable, it is unpredictable. All right, so now what about how you will take the preparation of the station 4? Okay, all right. So number 1 thing is that I want to mention that if any candidate, number 1, I want to mention that PACES work class. Okay, PACES work class. If you only do our class, suppose you don't have any time, you do our class very soul-heartedly with 100% concentration, taking all the notes and being interactive. And after our PACES work class, just go through the rider or team hall. Okay, rider or team hall for theory part of that station. Okay, like I have given you a case, we have discussed a case today. Okay, like a Breaking Bad news, or we have discussed a case of procedure. Okay, or we have discussed a case like refusal of the treatment. Then we can discuss a case like drug error. All right, we have discussed a case of the medical negligence. We have discussed a case of post-mortem, suicide. So whatever we do in the PACES work, like our course is almost 6 months duration. Okay, 6 months duration, and if we have we have two class per week, that means we have 4 weeks, we have eight classes. Okay, 8 classes per month. That means 6 into 8 classes you are having from the 6 months course. That means in the meantime we will do almost all the station 4 cases, including the vulnerable cases, and sometimes with repetitions. Okay, so most of the scenarios will be ended within the 6 months course. So if you just do our class and go through the rider and team hall, you will be a great candidate. So you don't need to be obsessed with so many other things. Number one. Number two, what else? Number two, Great Golden Guide. Read the Great Golden Guide very well. Okay. With Great Golden Guide, you just see the scenario, read the scenario, and then also refer to the rider and team hall. Whenever you read a case of the Great Golden Guide, okay, this was the case. So now, similar case in the team hall, similar case from the rider. The case will not be totally same. Scenario will be different, but the broad heading, but umbrella term will be same. So like in case of the procedure, like in rider, there is endoscopy. In case of patients, you will get suppose ERCP or MRCP. Okay. In case of rider, there is discussion about the suppose tuberculosis. Okay, tuberculosis as a chronic disease counseling. In cases, you might get hepatitis B or C or HIV. So the things will be similar. Broad heading will be similar. Ethical and legal issues will be similar, but case will be different. So if your knowledge is strong from the rider and team hall, and you solve the cases accordingly on the basis of your Paces to a class and the Great Golden Guide, then you are a pretty good candidate. Number three source is the internet. Okay, internet. Here in the internet, you will get some things like NHS leaflets. Okay, like suppose you are doing a case of ICD with HOCM. Okay, the patient is suffering from HOCM and consultant has told you to implant the ICD. Okay, so now you search in the Google that, okay, HOCM leaflets in the NHS Trust Hospital. So there will be so many leaflets regarding HOCM. Those leaflets are given to the patient's reading. Okay, you then give the search that ICD implantation NHS Trust leaflets. So there will be total leaflets regarding ICD implantation. So just go through those literatures and leaflets so that when you are counseling in your patients, these things are told by you and these things can be easily discussed by you. Don't worry about that. This is also not mandatory because in our classes, we try to give you that input. Our mentors are already teaching these things because we know that. So internet is very helpful. So another thing that is important is the, what should I say, the patient patient.info.uk. All right. So this website is also very important because in from your textbook like Davidson, Kumar and Clark and every books, you get to know about the terms in medical terms. But here in this patient info, you will know that how to describe the things to the patients or the surrogate and how to talk as a like in layman languages. So these things will be easier for you. Like you want to explain multiple endocrine neoplasia. So how will you explain that? You want to explain autoimmune polyglandular syndrome. So how you will explain that? You want to explain SLA to your patient. So how you will explain that? You want to explain hemochromatosis to your patient. So how you will explain that? So these explanation things and talking in non-medical terms, these things can be learned from the patientinfo.uk. You just make a list of cases case like a multiple sclerosis, adult polycystic kidney disease, type 1 diabetes, bronchial asthma, ulcerative colitis, SLE, tuberculosis, hepatitis B, hepatitis C, HOCM, multiple endocrine neoplasia, tuberous sclerosis. That means there are around 30 cases. In case of station 4, those are repeatedly coming in different ways. So those 30 conditions, okay, so go through the internet leaflets. So if you know that how they deal with the MS case, how they deal with the HOCM case, how they are doing the counseling in an ulcerative colitis case or asthma case, then what will happen? Then you can easily be a standard doctor. You can easily counsel your patients accordingly. All right. So these things are very important. So this is quite this is about the preparation of the station 4. So if you prepare like that, it should be all right. And there are already, I don't get any problems. There are so many free sessions in the internet by different mentors, so you can also enjoy that, no problems with that, so that's fine. But the thing is that you have to take preparation in that way, okay? And please, I want to mention one thing. Even we give you notes, even we give you text and all the things, make your short notes, short notes that how you want to do this particular station 4, and make a small diary for that. Because when you will be flying for paces, there will be very limited uh, scope of taking the books in the flight. So make some small diaries for each station. Like for station 4 there is a diary, station 2 there is a diary. That means you will take only notes when you fly, okay? Because you are not going to take so many books, Rider, Timol, or all the books you have with the flight to some other country, definitely, because there are some limitations. Even I had a bad experience when I took so many books in India while I give the paces, and actually what happened, I crossed the limit of the weight, and I had to I couldn't bring all my books back. I had to hand it over to someone in the hotel, that I cannot take it because I did so many shoppings, and after that I had so many extra books. And what happened, it actually exceeds the limit, and if I try to bring back everything, that I feel that I have to give some extra penny to the airport authority. All right, so I had to leave those books in India, unfortunately, okay? So there is no scope of taking so many books in some other country, you know. So that's why from now, practice that you will, what will you do, you will actually make your own notes, so that you can carry them easily and you don't need to take some bigger books. All right, so this is the preparation. And another thing, those who have much time and want to know about the paces legal issues and ethical issues, there is a book called Dr. Iqbal Station 4. This book is theoretical book, particularly discussing the theories of station 4, like you know, the ethical and legal principle, just theory part. So this book is not mandatory. If you want to know in details about the theoretical principles, so you can go for that. So this, I think that this should be enough for your paces preparation in case of station 4. All right, so those who are staying with us, and also those who will end up in this October, so try to practice more and more. Follow our classes. You already have taken our classes for 6 months, and already you have a great idea. So you can continue with us. And if you feel that you will not continue right at this point, so please practice with your partner, so that your paces preparation don't goes down slope. Because paces is a dynamic preparation, so you have to definitely practice and practice. No pause is accepted, no pause is accepted. So definitely you have to continue your preparation like that. All right, so now I am coming to the preparation of the station 2 and station 5. Always the most vital thing is that always prepare station 2 and 5 as a single unit. These two are actually almost similar thing. So take it as a one unit, not different one, This is the most vital thing. This is the most vital thing, number one. Number two, what is the specialties of this station? I want to tell you that it is the beauty of paces. Okay, candidates who are very good at station 2 and 5 will easily pass the paces. Please note it. Please note it. I want to repeat again. The candidate who are best at station 2 and 5 will easily pass paces. I repeat again. The candidate who are best at station 2 and 5 will easily pass paces. So it is the beauty of paces. Okay. So art of history taking. Art of history taking. This is the most vital beauty of MRCP PACES exam, that how much you are matured to take the history so smartly, in a structured way, in a organized way, with great pace also, not slowly, with pace, okay? According to the importance, according to the sequence of importance, showing your maturity level, okay? So these things are really something special, and if you really want to pass the paces, you have to attain that skill, okay? So this I call the beauty of paces. Number two, what is the most another vital thing? It is the most predicted thing. It is the most predicted thing. Why it is the most predicted? Because every examiner all over the globe, every examiners all over the globe are very much similar. All right. So they will be, whenever you are giving the exam in front of them, so what will happen, they will easily understand that whether this candidate is ready or not. The way you talk, way you take the history, way you examine the patient, it is clearly gettable that whether this candidate is matured or not, and is he ready to pass the paces and become a specialist in the NHS trust or UK or not. So it is quite standardized. It is not that the calibration is different. It will vary from examiner to examiner very rarely, because all the examiners think similarly. The approach is same. The headache approach in India, in Bangladesh, and in UK is similar. So the way you take the history of the headache is similar all over the world, and they will see that whether this candidate has attained that maturity level or not. Suppose a patient is having coming with a quite severe headache, all right. So suppose you miss a question of fever, all right. Suppose you miss a question of fever, that means you are missing the meningoencephalitis, you missing the infection. So this the examiners will never make you pass. So they give you a case of fever, okay. They are giving you a case of fever in case of patients in the station 5 or 2. You don't ask questions of night sweats, chills and rigor, all right, excessive sweating, drenching sweats. So if you miss these pearl questions, they will never give you mark, because you didn't ask about night sweats. So night sweats means tuberculosis, night sweats means lymphoma. You didn't ask about excessive sweats. So if you miss about excessive sweats, you are missing about some lymphomas. So these pearl questions are very important. If I tell that whether you know that how you have to exclude a differential diagnosis, like how will you exclude a case of uh, suppose hemochromatosis, how you exclude a case of pheochromocytoma, what will be the questions for antiphospholipid antibody syndrome, what will be the questions for systemic sclerosis, what will be the questions for hemochromatosis. So what are the paces hot diagnosis, and how to ask questions for that. And there is no scope that you will ask question incompletely, so your questions will be sequential according to the importance, and you have to complete your questions to reach the diagnosis and exclude other differential. So it is the beauty of the paces, and you have to practice and practice, and also follow our classes very attentively. And not only that, then from the books you have to compile your own notes, own thoughts, and you have to meditate it repeatedly. So if you do that, then you will be a very good candidate. All right. So it is predicted one. If you take very good preparation, then you will easily pass paces. Very important. All right. Then come to the point that it is actually approach based, okay. Approach based, all right. Approach based means that some candidates do a mistake, that some of the textbook they have written about migraine, okay. They have suppose in station 5 they will teach you rheumatoid arthritis, they will teach you like ankylosing spondylitis, they will teach you migraine, they will teach you TIA. All right, that means in those textbook they will discuss the station 5 or 2 as diagnosis basic, that it is the diagnosis, so what will be the history will take and what will be the examination you will do. But it is not correct way. The what you have to read is that you will actually read joint pain. Okay, you will actually read joint pain, and with this joint pain you have to cover everything. And here in this joint pain, rheumatoid arthritis will come, SLA will come, other arthritis will come. Okay, so you have to be mastering the joint pain. If you can master the joint pain, you can you can do any musculoskeletal case. All right, so this sort of you have to take preparation approach wise, topic to topic, symptom wise, so that I suppose one day you decide that okay, I will just today take the preparation on the joint pain, and with my partner I will practice joint pain, like give your partner a case of ankylosing spondylitis, your partner might give you a case of rheumatoid arthritis, or you can give your partner a case of the SLE, or your partner might give you a case on the something like reactive arthritis or anything like that. That means a joint pain is a patient's case, so you have to do mastering on that. It is not like that you know very well rheumatoid arthritis. It is not like that you are master on the ankylosing spondylitis, but you don't know the approach of the back pain. Okay, suppose you are master of the ankylosing spondylitis, so your case will not be ankylosing spondylitis from the outside. Your case will be back pain. Okay, so it is okay that you know everything about ankylosing spondylitis, that what history you need to take, what examinations you will do. That's fine. But whenever you are outside the room, it will not be written that it is the ankylosing spondylitis. So there is a possibility that pain might be due to the metastasis in the vertebra. It can be Pott's disease. It can be multiple myeloma. Okay, so it can be psoriatic arthropathy. So there are so many back pain things. So you have to prepare yourself for the back pain. And whenever you enter into the room, you will start taking the history. Within 1 or 2 minutes, it will be apparent that which way it is going. So if it is ankylosing spondylitis, just after inspecting the patient, then there is no problem to do the ankylosing scheme. Okay, so but take preparation on the joint pain or the back pain in total, but don't be too much focused on a particular topic. In that case, your preparation will not be completed. So my important message to you all is that take preparation on the broad headings, broad symptoms, and make your stepwise patterns, that how you'll approach afterwards. Okay, so approach based preparation. So now what will you do for your paces preparation for the station 2 and 5? Okay, so I want to mention that what you can do is that make first task is to make an index. This is the first task. So what is the index mean? Index means that it is the topics or the approaches you need to build. That means, okay, number one is neurology. Number one is neurology. Okay, so what are the neurology case that are coming in the paces? So it can be a case of fits or collapse or seizure. Okay, then it can be a case of tingling or numbness. It can be a case of vision problem. It can be a case of headache. It can be a case of weakness, that weakness due to TIA, weakness due to stroke, weakness due to myopathy, weakness due to peripheral neuropathy. Okay, so these are the neurology scheme you have to do. So make your plan like this. Okay, today I will read the feet collapse or seizure. Another day you will read tingling and numbness. Another day you will read the vision problem. Another day you will read the headache. So whenever you will start taking preparation on that, what will be your task? Actually, station 2 and 4, it is not 100% in any of the paces book. I want to make you clear that it is a note based preparation, and already for throughout our course we are teaching you that. All right, throughout our course we are doing so many station 2s, so many station 5s, so we teach you everything, I think. Okay, so the way we think, the trend of thoughts that we have, if you can follow that, you will be a perfect candidate. And just you have to coordinate your thinking with ourselves, that how the your mentors are teaching you, how we are thinking, what is our thinking. So whenever you will get to know that, then paces will be easy for you. All right, so whenever I can see that the sequence of questions you are doing is just similar of our thoughts, whenever a paces examiner is taking your examinations in the paces, he has his mind set up. He expects some questions sequentially, that my candidate will ask this question, after this question sequence will be like this. Whenever there is any breakage and in the questioning, we can easily understand that this candidate is not going that way. That means his history taking sequence is not absolutely right. He is going bizarrely. That means his sequence is not right. He is going right side, left side, right side, left side, but he is not hitting into the point, and the sequence is not right. We can easily get that. Any paces examiner can get that. So that you have to be very much organized and try to pick up that how your mentors teach that. So for that, regular attendance in the class is very important, because when how much you go for the recording, it will never give that vibe. It will never make you a good candidate if you don't do the real class, because in real class you will definitely, your attention will be more, and you will get to know that what will be your thinking of the mentors, so that it will be very much easy for you. So whenever you will do a, suppose today your task is to do the feeds or the scissors or something like that. So first ask about the differential. Okay, so formulate your differential on the class, like we have taken a paces. So what are the common paces case that comes with feeds? Number one, so your differential will be like that. Then you take help from the your paces book. So what are the paces book? Okay, rider, it can be OST, it can be paces manual. Okay, so some candidates become frustrated that Dr. Shadli, you are telling about so many books. I really want to say that, doctor, I am not telling you to go through all the lines of that book. Okay, so it is not that I am telling you that go through total rider, go through total OST, go through total paces manual. It's not like that. Just open the chapter of the feet, just open the page. Okay, that will do. Just remember my talk, what I say. Just open the page of that book, and only that will do. You don't have to read that, because paces is that much easy. Because whenever you will open the paces manual, okay, suppose you will get to know that, okay, what differential diagnosis they have thought, what are the discussions in the rider station 2 or 5 book regarding the feeds, what is the thinking of the OST, what are the differentials they have thought. All right, so first make a firm DD, so that everything or is already in your mind. Because always keep in your mind that in station 2 and 5, differential diagnosis is 50%. If your differential is strong, and you really know that what are the paces case and what are the paces differentials, your 50% task is done. Okay, your 50% task is done. That's why I tell you, when you formulate the differential, take the preparation from our classes, what your mentor says, number one. Number two, take the help of different paces book, that who, which this differentials are discussed on those particular symptoms. So write it down, make a note on that, that these are the differential of the fits. Okay, and then come to the vital part, that is the questioning, that what sort of questions you want to ask for the fits. Okay, so here particularly rider book is very good. It is concised, questions are limited in number. Okay, vital questions are given very well. And there is two book, Rider Station 2 and Rider 5. So whenever you actually reading a particular case, open both books, both the Station 2 and 5, and write down those questions in short in your notebook, so that you know that particularly it is very much helpful for the beginners, because if you write it down in your notebook, then you can easily memorize it, and you can ask these questions very easily, because whenever you write something, it is far more better than just reading. Reading will never help you that much. That will be done by the writing. Okay, so write the questions very shortly, that what is the symptoms, what are the OD-para, onset, duration, progression, aggravating factor, relieving factor. Then ask about your pain, or what about the complaints. So the way we practice regularly. So make notes on the question. So you can take help from the rider, you can take help from the paces manual, you can take help from the OST. There are some also very good note that was previously shared, that is the Sonam Techaring note. So whatever, I think I don't want to mention any book name, just make your question list for that topic. Okay, question list, that what questions you need to ask in that particular patient according to the history format or station 5 format. You know, all know the formats, right? That present history, past medical history, drug history, family history, complication, risk factor, associated factors. So the format. So according to the format, what will be your questioning? So make that question list one by one, point by point, according to the history format and the station 5 format. So your task is almost 70% done. Okay, then come to the preparation, that whenever you are thinking for that, after, what will be your next task? Your next task will be like, your next task will be examination. Okay, particularly this is for not for station 2, station 5. Like for collapse or fits, you have already taken the history, already you know that how to take the history. So whenever you do the practice for that, so you already mastering it. And after that, what will be the examination scheme for the, station 5? Okay, what will be the examination scheme for the station 5, and you have to do it accordingly. All right, so just make a note that for a collapse case, what will be the examination scheme? For headache, what will be the examination scheme? For abdominal pain, how will you examine the patient? For leg edema, how will you go for that? For chest pain, what examinations are more important? For hypertension, what will be important? For palpitations, what will be important? Like in a case of palpitation, you have to examine the thyroid gland. So if you don't note it down, in paces you might forget that. In a palpitation case, you have to look the thyroid. So if it is not ready, then you might fall. In a case of headache, sometimes giant cell arteritis might come. So you have to palpate the temporal artery. So if you forget that, you will do the blunder. All right. Sometimes there is a possibility in a case of chest pain, there might be some aortic stenosis. So you have to auscultate the aortic area very well to get the aortic stenosis. Okay. So there are so many things like that. A case of Addison's disease might come with abdominal pain. So in case of abdominal pain, so it should be kept in your mind that it can be Addison's disease. So postural drop might be an issue here. Okay. So there are so many thinking related to station 2 and 5, and it is the matter of meditation. No books, no mentor, no one can make you 100% prepared if you don't help yourself. You have to help yourself, and you have to motivate yourself. And if you do like that, you will be a very strong PACES candidate. So you have to do that, and please follow our class. We will give you every possible clue for that, and you will be a very better candidate afterwards. All right, this is the thing. Okay, so this is about the station 2 and 5, and just go through that. And regarding the resources, okay, so if we tell about the resources, that what books are very best, already I have told you that. Now number one is our class. Our class note is the best thing I want to mention. Class is the best thing. Number two is, I want to mention that Sonam Techaring is a Sonam station 2 and 4, the notebook from the Bhutan doctor. He is also my friend. He is very good. Particularly his note is very good, and I think that this note is very fruitful. It is previously given in the group. If you want, I can upload it again. So Sonam book is very good. You can take preparation basing on his note. This is quite pretty good. So you have to customize it, and this note is based like this. He has also made this note 2 and 5 in together. So this is the good approach. I want to say that. And number 3 is that rider 2 and 5 always read in total. Fourth, if I say fourth, this should be Pace's manual. Okay, Pace's manual. And for just theory part, not for everything, OST is plus minus. Okay, so don't be worried about so many books. I'm telling you, you have to just have a look. You don't need to recall it, you don't need to memorize it. Just open the book and see that what questions are done, what differentials are done. It is not like that you have to memorize it, you have to recall it, you have to frequently read it. No, only see the headlines, only see the differentials, only see the questions they are doing. So it is matter of only, I think, this note making and this taking preparation for part symptom. It will take only 30 minutes, not more than that. So just there are 30 symptoms, so it can be ended within 2 symptoms per day. So you can end it within only 15 days, I think. And after that you will just see the change. You will be better candidate than anyone else. Okay, so work on the station 2 and 5, and this is the most vital part of PACES preparation. Whenever you will complete this preparation, your 50% PACES preparation is done. Okay, so this is the most vital thing I want to mention. So this is about one of the vital thing, that is the secrets of PACES. Okay, all right. Then I am coming to the preparation of the station 1 and 3. Okay, station 1 and 3, this is very important. Station 1 and 3, what will be the approach for that? Okay, I forgot to mention that in station 2 and 5, it is very good to go through the Great Golden Guide, particularly see the diagnosis only, that what are the diagnoses of the station 2 and what are the differentials. So for a quick look over the Great Golden Guide, just make a note on the it will make you a good candidate very early. That if you go through the Great Golden Guide, you don't need to do it totally. Just station 2 and 5, write down the diagnosis of that and the differentials for that. Like whenever you are going through the Great Golden Guide, like headache. Okay, headache. So throughout the Great Golden Guide, which cases come with headache? So if you go like that, those differentials will be the best differential, because in PACES, headache comes with this. All right, so it is evident from the Great Golden Guide. The mentors are teaching like that. We people are trying to teach you that these are the PACES case. But if you do it by yourself from the Great Golden Guide, that okay, with headache this comes, with leg swelling these things are coming, with abdominal pain these things are coming, with shortness of breath these things are coming. Okay, so you can easily formulate it. Can anyone say that what okay, then it will actually take many time. We don't want to take your time so much. So this is the way you have to take the preparation for the 2 and 5. Please go to the Great Golden Guide and see the PACES case. This is very important. All right, now for the station 1 and 3, actually this preparation is actually number 1. You need to know the case list very well, because if you don't know the case list, you will spoil your time to read many unnecessary things. Okay, suppose you are reading collapse in case of respiratory system for 2 or 3 days. Okay, you are suppose reading, what should I say, some some other unimportant cases for so much time. And another thing, what happens if you think about rare cases, you might say it in the PACES exam and your diagnosis will be wrong. So at first work on the case list, and we have already talked on that, and there will be other sessions in the near future regarding the case list, that which cases are coming in the PACES. You need to know it first, number 1. Number 2, presentation of the case. Okay, that how you will do the presentation. and we'll actually, you don't need to bother about that. We will give you note. Already we have give you note on one note, and some other notes are coming. So presentation will make you that. All right. Number 3 is that some theory knowledge, investigation management, these parts. Okay, so you don't need to bother about that, and we will give the investigation and management note. That part is also being made, so you don't need to bother on that. Okay, so it will be given by the places work, and you don't need to go for that anything. You don't need to read anything for that. And also the clinical tips and tricks, we will take class on that how you will easily get the vital clinical signs, and how you can formulate the signs and reach to the diagnosis and differentials very early. So there are some clinical tips and tricks related to that, and for that reason some books are very well, like OST, then the PACES manual. These books are very good, PACES manual. So here they will discuss about the how which signs are very important, and how you will correlate your sign, and how you will present that. So this clinical tips and tricks class, and clinical reasoning, and how you will coordinate these things in the PACES exam. So it is the quite specialized things. We are already have taken classes, and there are so many sessions on that. So don't bother about that, but try to read the OST very well and PACES manual very well, because these books are very good, and it will open up your eyes. All right, so go through that, and this will actually help you. And another thing, actually we don't have any ways, like this is the practice part. Okay, that you have to practice a lot in the hospital, particularly in the common cases. So you are lacking on that, I know, all over the world. So what you have to do, you have to keep patience, and at least in your home, try to make your examination skills very fast, and at least try to examine someone from your home. It can be your brother and sister, it can be your spouse or someone else. Just okay, examine the cardiovascular system, examine the respiratory system, just like PACES. There are so many videos in the YouTube. So at least your physical examination skill is passed easily. So you just go for the examination of the patients, and it will be very much helpful for you. At least it will make you pass the physical examination skill. It is another skill, right? So pass that one. And picking up the sign thing, we are planning for some videos already, and some signs already. There are so many YouTube's videos on different cases. You can go through that, and some pictures on that, so you can go through that. And but I'm really sorry to say that COVID situation is not even very good, and there are, even in Bangladesh, the academic cases are not available in the hospitals. So we are very much frustrated for that, and the scenario is similar in all over the world. So we cannot help for that, but we have to think that we will get the very common cases, and we have to be confident. We have to feel that okay, my examination skills are okay, I can easily examine the patient. So this skill can be attained from your home. Examine randomly without any physical sign. And for physical sign, you know that what you have to see. We have seen many candidates who work in corporate sector, like we did some courses in abroad for 4 days case. There some candidates joined, they had no scope of academic case seeing. They just only attended 4 days course, and give the PACES exam and passed. So it is not that very much tough. What happens, you are very much acclimatized with seeing so many cases, so that you are getting nervous that as we are not seeing cases like before, so we will fail. It is not like that. So if your case is chronic liver disease, if your case is COPD, if you are given a case of mitral valve replacement, and your neurology case is stroke, so do you think that it needs so much practice? I don't think so. So it is a common PACES carousel. In station 5, in station neurology station, you might get a case of facial napalsy, you might get a case of the stroke. In cardiology, you might get a clean cut case of aortic stenosis, very commonly in UK. Aortic stenosis is very common, or a case of the MR. So it is not that much difficult. In abdomen, you can commonly get a case of the renal transplant. In 50% case, there is a possibility that you might get adult polycystic kidney disease or renal transplant or CLD. So these three cases almost it comprises of almost 70% of the abdominal cases. So it is not that difficult. Coming to the respiratory system, ILD, ILD and the pneumonictomy, lobectomy. These three cases are coming frequently. So there's high chance that you will get that case. So why are you getting so much nervous that as you are not practicing, you will fail? So this carousel is not that much difficult. You can easily pass. Okay. So the most vital thing is that whether you have that confidence on you that, okay, carousel might be easy. Carousel might not be so much difficult. So Dr. Saida, you are experienced. Dr. Arif, you are experienced. So do you want to differ with me that this is very common carousel? So if I made a carousel like this, like you are given a cardiovascular case, aortic stenosis, you are in respiratory system, you are getting a case of the ILD. In abdomen, you are getting a case of the renal transplant, and in neurology, you are getting a case of the facial nerve palsy or stroke. So Dr. Arif, you tell that is it a difficult carousel, or is it a very tough carousel to pass? Do you want to say?
No, I don't think it would be too much tough, because
and it is the commonest carousel, isn't it? It is the commonest carousel, isn't it, or not?
Yes, of course, no doubt.
So go through the Great Golden Gate. So why you people are so much nervous that you are not practice so much? So the vital thing is that you are not skilled in the examination. Your hands are jammed. You are not practicing. That's the problem. So it should not be a problem. Examine on your husband, examine on your brothers and sisters, or anyone from your home. So just be smart in the examination. There are so many people at the home, you can examine on anyone. So that your physical examination style is totally fine. You look very good, and you are very much fast, just like before. So you did it in the hospital with the real case. Now you practice with the home members, but the cases will be very simple. So don't think that, yes, I acknowledge that in PACES work we have shown varieties of cases, very difficult cases, but in real PACES scenario, most of the time it will not be very much difficult. You will easily get that. So don't be nervous for that. Just prepare for the common cases and be very confident for that. And particularly the most vital preparation is like this. Okay. All right. So this was about my today's talk. I think that this is what I meant for, and this instruction I have given is for all stages of candidate for the PACES work. Actually, those who are ending in October. So that if you don't take extension in the PACES work, I really want to say I do good wishes to you all, and please practice with your partners. And whenever your exam dates are ready, please join PACES work again for the intensive or the regular course, so that you can carry on your preparation. So this is very important, and always remember that PACES is a dynamic preparation. So I will definitely recommend that extension is the good idea. There is no doubt about that. And those who are at the middle of your preparation, like you have subscribed for the 2 months or 3 months or first 1 month, so you have almost 4 to 5 months left or 3 months left. So much time to concentrate on your preparation on the basis of our guideline that I have given you today. Okay, so this is for you, that you can make yourself corrected, that your preparation was not up to the mark previously, but from now on you will utilize this course to the fullest in the next 3 months on the basis of today's guideline. So this was my another issue. And for those who are going to take part in the intensive from the next Sunday, okay, there is some announcement that we are starting the intensive from 25th October, and it will end in the 6th November. And I have told that within this period of time, our regular classes will not be conducted, and we will actually miss around 2 or 3 regular classes. So I commit that for our regular candidates, these classes, these 2 or 3 classes will be given extra to your PACES tenure. So don't be bothered about that. In the meantime, those who are not taking part in our intensive course, please do your baseline works, like make notes on the station 2 and 5 approaches, go for the station 4 cases, survey the Great Golden Guide, work on that. So the desk job, your mental preparation from your home. So within this 1.5 period, take a pause, take a refreshment, and go for your baseline foundation work from the textbooks and make your own notes, survey the Great Golden Guide, and follow our guideline that how you have to take your preparation from your home. So this is a very good idea, so that when you resume from the November after November 6th, so that you are a new candidate, you are a fresh candidate, and you start with full-blown preparation. And hopefully there is some freshers will be added in the course, so it will be a different vibe from the November onward. You will feel quite better, I hope. This is the thing. And for the intensive participant, there are, I can see many intensive participants here, Dr. Saida Chaudhary, Dr. Saif Kibria, Dr. Arif, Dr. Rini, so Dr. Farhanaz Rahman, Dr. Sanjana Fahim. Okay, so the candidates who are enrolled for the intensive, so I want to give you a very strong message that take this intensive as a very serious one. Feel like that within these 10 days you will completely end your PACES preparation. Like, not only you will take our classes, in the meantime, during the morning period or whenever you give time, do the foundation work, do the your own note. So just down in the PACES preparation, like feel like that your exam is in the November, even it is postponed, so that this intensive becomes highly fruitful. And if you get seat in the first ride, so that your chance of passing the PACES will be very high. And we hopefully, inshallah, we will arrange another intensive on the February. So if with this sort of preparation, you will easily pass PACES in the first ride, inshallah. So within these 10 days, don't only rely on the course. Our course will be blast, there will be no doubt about that. All the mentors are totally ready with so many different cases. But the thing is that don't spoil your own time. Take these 10 days as total PACES preparation time, so that go through the theory part, go through the station 1 and 3 theories, go through the Great Golden Guide cases, make your own approach notes on the station 2 and 5, and total preparation meditation, what I told previously, so that it becomes so much fruitful for you for the 10 days. And just after that, your regular course will be resumed, and you will continue as a different candidate after the intensive, hopefully. All right, so this is all about the thing. Any queries or questions from our today's class? So I will take the questions right now. Any questions regarding any preparations or anything like that, you can ask me questions. Any questions from today's class? And another, if there's no questions, I really want to say you that the candidates who joined me in the May, actually it is very much frustrating for me, and it is very much sad for me that even you candidate become very well prepared, and I'm very happy with your preparations. I can see that some candidates are not there, like Dr. Shraddha is have joined right now. Dr. Shraddha's preparation, Dr. Aditya, Dr. Dr. Kirti Mishra, okay, Dr. Dibyendu. So yes, Dr. Shraddha. Yeah.
So please keep intensive core in January or February when our exams are there. Please, I request you.
No, definitely. I have that plan. Definitely, Dr. Shraddha. I have that plan, and it is the PACES work always there.
We have five
Yes.
people will be there for sure. Whoever
Yes,
are
yes.
answering.
Okay, thanks a lot. Thanks a lot. I
Thank you,
know
sir.
that you love me. That's very much blessing for me, and inshallah you will be with us. And the thing is
Yes,
that
sir.
PACES work normally always arrange the course in the just before the month of the exam. So it is the October is always the month of intensive for last 3 years, and February is always the month of intensive for PACES work. So if everything is perfect, then definitely we will arrange the intensive. There is no doubt about that. But even though, I think another thing, those candidates who enrolled as listeners, particularly those who didn't have the scope to practice with us, like Dr. Shahadat from UK, Dr. Dibendu, and some others, Dr. Maisha. We have two candidates called Maisha here in this group. They are maybe not here because they actually rely on our recordings. So those candidates who enrolled as listeners, definitely your preparation was not up to the mark. So it is the time to become the active participants and to play in the real world, so that you become a very confident candidate for the first dive. Okay, so actually I want that all the listeners for the last 6 months, those who are the basis beginners, no idea about the paces, they started at the beginners as the listeners. So it is time for them that you can turn to the active participants and make your preparation very confident and appear in the first dive exam. This should be a very good thing, I think. Okay, so this is the thing. And those whoever want extensions, you can knock me and we will give a plan, customized plan for you. All right, so this is the thing. And inshallah, hopefully, good wish to you all. It is a break of the course for one and just what should I say, maybe almost 1.5 week. After that we will resume with full blown preparation. Okay, and new vibe, new passion. And please, in the meantime, we will give some ads for the November admission. And those who love me, okay, those who love me and love Paces Work, please do some publicities for us. Okay, all over the world, like India, we have some very close Indian candidates here in this course, in this diet. Those who are very active, and I will really miss them. Actually, I want to mention that. So we want candidate from different parts of the world. It is very good to share experiences, share thinking about different people from different countries, doctors from different countries. So it is good for us. All right, so please continue some publicities for us. We want to make this global vibe in our course always, so that it stays something special. All right, so we want your support, so that we get some more candidates who enlighten the Paces Work. Okay, we want to think that Paces Work is a family. We always think like that. We involve so many mentors, and whenever you will pass the Paces all over the world, you are very much welcome to be the mentor of the Paces Work, because it is not only for the business purpose. We always try to involve those with the good soul, those with the good medical knowledge. We want to involve them. It is the passion of the Paces Work, and that's why we are here today. So many candidates rely on us, and we have a reputation that no one gets disheartened from the Paces Work. As far I know, if you have anything regarding any negative thoughts about Paces Work, you can easily tell me in the open group. I will try to explain, or you can inbox me. Okay, so I don't mind, because I want criticism that this course was not okay, these things was not good. From my corner, from the founder side, I have tried my best to involve the best mentors. There are, every mentor has something special. Okay, something special. It is not that Dr. Shadli knows everything. Okay, it is not that Dr. Ratul knows everything. It is not that Dr. Shaila Rahman knows everything. It is not that Dr. Karishma knows everything. Every mentor of the Paces Work have diverse capacities. Okay, diverse specialties, and some extent they were somehow my candidates in the Paces Work. So I know their strong zone. Okay, like Dr. Arif is candidate right now. One day you will pass. I know that what is your strong zone, and I know what is your weak zone. So when you will take class in the Paces Work, I will give you that station that was your strong zone during the preparation time. Like you might be given the station, some cases I know that you will do better. So the cases are given by me. Okay, the cases the candidates take in the Paces Work, the mentors take, all the cases are formulated by me, that okay, you go for this case because you can do that. I don't give all the cases to all the mentors, because I know that which mentors are capable of doing what. Okay, and I customize that preparation in that way. I think that no course of the world do these things, because most of the cases are name wise. I don't want to mention the name, one man army. So it should not be, because one man cannot do anything. Every unique mentor has something very special, and Paces Work believes in that to bring out that speciality and disperse this into the candidates. So that's why the Paces Work, I believe, is the best, and the best result we are providing over last 3 years, because we always believe in that. So please always stay with us and promote us and feel like Paces Work family. And whenever you pass the Paces, you are on my side, in the Paces Work mentor side. All right. So this is the thing. I think that it is so much talk I have done today. It is actually a special session, and actually hope that we will start in a brand new pattern in the November with some special things. And for the intensive participant, finger crossed, and be mind setup is the main thing. So please be very much ready for the intensive, and we'll start from the Sunday. Already the routine has been given, so just make yourself motivated that how you want to make this day. And if you have any very busy schedule, so if you take some leave from your job, or some workplace, at least 3 or 5 4 days, so it will be very good. So try to be quite free in this period. This will be very good for you. All right. So good night to you all, and this session is also recorded. And another thing, those who are ending right at this point, so your subscription period is ending. So the videos already in the groups, I will mention that we will give you some time until November, until October end, so that watch out all our videos and everything, because I think that your subscription is going to be ended in the October, and after that we will everything do a total reshuffle because of the new courses from the November. And until that, your subscription with the Facebook groups, WhatsApp groups will be valid until the 31st October. And after November, everything will be in the new pattern. All right. So this is the thing, and good wishes to you all. Goodbye. Good night.